Jane Doe, Dr. Gray will see you now.
So, what can I help you with today?
I think I may have cancer, doctor. I put my symptoms into WebMD and it said I have it.
Oh, you're a hypochondriac. I have a friend who's a dietitian who's recovering from that as well. Anyway, what are your symptoms?
Well, I have a sore nipple and general discomfort in my left breast. And this morning I noticed that my nipple was bleeding a little.
Okay, here are the symptoms for breast cancer. And as you can see, you have these three. However, I don't want you to start worrying before we start doing some tests.
What type do you think it is, doctor? I know there are different kinds of breast cancer.
You're right, there are several kinds. These are the different kinds. I think you have ductal carcinoma in situ, which is a very mild form of cancer.
Oh, could you describe the cancer to me, please?
Yes, of course. Ductal carcinoma in situ, often known as DCIS, is the most common type of non-invasive breast cancer. Ductal means that the cancer starts inside the milk ducts. Carcinoma refers to any cancer that begins in the skin or other tissues. Breast tissue, in your case, that cover or line the internal organs. In situ means in its original place. It's called a non-invasive because it hasn't spread beyond the milk duct into any normal surrounding breast tissue. It isn't life-threatening, but having DCIS can increase the risks of developing an invasive breast cancer later on. You're at a higher risk for the cancer coming back or for developing a new breast cancer than a person who has never had breast cancer before. And most recurrences happen within 5 to 10 years after the initial diagnosis.
Oh, I see, doctor. But how do you treat it?
While we don't know what it is yet, there are generally two types of procedures, local and systemic. Local treatments are some you've probably heard about already, such as surgery or radiation. That means that it's focused on a very specific area. Systemic, on the other hand, affects the entire body. Treatments include hormone therapy or chemotherapy.
What are the pros and cons of each treatment? I mean, they all sound pretty terrifying.
Well, each has their pros and cons. Surgery, for example, actually comes in two forms: breast-conserving surgery, BCS, or mastectomies. BCS is where we just target a very specific area of the affected cancer cells, whereas mastectomies, you can remove the entire breast. It works by cutting out the affected area.
How can there be any positives to that?
A mastectomy, where you remove the breast, has shown to be effective in combination with radiation therapy and chemo. Some consider it better when BCS has not completely removed the cancer, or perhaps cancer is large relative to breast size. For young women like yourself, when we know that there's a mutation in the BRCA gene, we recommend that mastectomies be used.
But if I didn't want to go under the knife, what else could I do?
Something a little less intrusive on the local level is radiation. There's also two types, external beam and radiotherapy. These are both done either outside or inside the body.
Aren't there a lot of risks with radiation?
Of course. Radiation works by damaging the DNA of the cancer cells and thereby destroying them. But in doing so, you're also damaging the healthy cells. But we hope that the healthy cells recover from this treatment.
Is that all?
Well, in some cases, individuals can get radiation burns, but that's a rather small number. There is also risk for breast reconstruction if women decide to do that later on.
You mentioned systemic treatments. What are those?
Systemic treatments, in contrast to local, affect the entire body. A common treatment is chemotherapy.
Oh, I've heard of that.
Yes, it's where drugs are either injected or taken orally, and they travel into the bloodstream to target the cancer cells. Often, this is done in cycles lasting multiple months. Chemo can be done before or after surgery.
I've heard a lot of stories about it. What are the actual side effects?
Because of the powerful of the drugs, such as anthracycline and taxane, they can cause hair loss, mouth sores, loss of appetite, nausea, and low blood cell counts.
Ooh, this doesn't make me feel any better about this. What about hormone therapy?
Hormone therapy is perhaps a little less dramatic. Basically, cancer cells are stimulated by a woman's hormones, estrogen. They are what we call estrogen positive, but not the best kind of positive. Drugs like tamoxifen replace estrogen in the cancer cell and stop the growth.
Wow, that sounds much easier. Just a pill and you're done.
Not exactly. Hormones, especially estrogen, are an important part of a woman's daily life, responsible for growth and female sexual characteristics. When we introduce drugs and mix the natural balance, it will make you feel different. You could feel tired or even moody, and this can lead to just a very bad day.
Well, I feel like I understand a little better what many women go through. It's tough.
Yes, it's a real fight, but I've read some interesting new research about cannabis and how it's impacting the treatment of breast cancer.
How does that work?
There actually have been numerous studies about the positive effects of cannabis, such as the study published by the United States National Library of Medicine, a study published by the Journal of Pharmacology and Experimental Therapeutics, a study published by the Journal Molecular Cancer, and even a study published by the Proceedings of the National Academy of Sciences in the United States of America.
Scholarly Cancer Review article published in 2009. There were over 421 chemical compounds identified in the cannabis plant. And within this group of natural substances, there are many chemicals that have significant anti-tumor properties at low enough doses to where they would be effective cancer treatments. That's an important part of this. It's one thing to be able to kill a cancer cell, but could you really survive such? There's a wealth of laboratory evidence that these anti-tumor properties kill cancer cells in a variety of ways. There are multiple mechanisms of action identified by which cannabis kills cancer cells, and they're divided into various categories. And among these are anti-proliferative effects. Normally, that's one of the hallmarks of a cancer cell, is that it just keeps reproducing. So if you stop the reproduction, that's an anti-proliferative effect. There are anti-angiogenesis effects, and this means that the cannabinoids will stop the tumor from being able to elaborate or grow new blood vessels to support the growth of the tumor. There are anti-metastatic effects, and that is simple enough to mean that the cannabinoids block the ability of the cancer cells to spread into other tissues. And there's another effect that has a wild name, apoptotic effect. Apoptosis refers to the ability of cannabinoids to speed the death of the abnormal cells. That's something that is especially important in cancer, because you're able to hasten the death of the cell without disturbing the normal cells around it.
Seth Research Laboratories in California have recently demonstrated that in some tumors, cancer cells are killed by marijuana, while the other healthy cells are left untouched. Cells that stop moving and become still white dots are dead cancer cells.
Now, as a medical practitioner, I can't recommend this alternative treatment. However, if you decide to do it on your own choice, I would suggest ingesting it rather than inhaling it, because it avoids the carcinogenic effects. Now, if you don't have any more questions, I'm glad you came in today. I hope that this meeting was very informative for you.